So it's my pleasure to introduce Juliana going over. Obviously, I've been in a couple of different classes. So I've had her in cancer biology, intro to research, and health and health disparities as well. It's been so much fun to watch her grow throughout the years. So intro to research, you started this project, correct?
Yes.
So intro to research, I make them just write a short paper, reviewing a couple of different articles, and she chose this topic and then really ran with it for her honors program. And so it's just a lot of fun to watch students progress, and Juliana has done such a great job with this project and just having her in class. She's very insightful. It's a lot of fun. So health and health disparities is a discussion-based class. Just hearing her perspective on things is great, and I'm just confident that you're going to do so well in your next steps. So anyway, we'll let Juliana take over and talk about glioblastoma and treatments for glioblastoma.
Thank you.
Yes.
Yes, as Dr. Schneider said, my name is Juliana Koperski. Today I'm going to be discussing glioblastoma and then the impact of methylation of the MGMT promoter region, specifically on treatment. And so to begin, I want to talk a little bit about why I chose this topic. This here picture is my grandpa. He unfortunately passed away from glioblastoma right before I started high school. And that was really my first exposure to the specific type of brain cancer. And watching him kind of go through that. Jump ahead a couple of years, and I'm in college, and able to take cancer biology, where I really grasped a greater understanding of cancer and how complex it is, since it is more than one just disease. It's a very large group of diseases. And then in intro to research, I was able to choose a topic and kind of explore more about it. Shortly around that same time, I was job shadowing a radiation oncologist, and I was able to interact with a patient who also had glioblastoma. And this radiation oncologist was able to explain to me how the impact on whether or not they can do surgery, and then the methylation status of the MGMT promoter region can impact their course of treatment and how physicians kind of come up with a game plan on how to progress with treatment. And so my goal with my honors project was to understand how one small segment of the DNA can have such a profound impact on chemotherapy, specifically the success rates of it for glioblastoma. And so today I'm going to be providing a lot of background information because there's a lot of science that goes into this. I'll start out by kind of talking about glioblastoma, specifically as it is a type of brain cancer. And then we'll kind of switch gears a little bit, talk about the MGMT protein and its role in DNA repair. And finally, I'll mention DNA methylation because it plays such an important role on the treatment of patients with glioblastoma. So glioblastoma, as I mentioned, is an aggressive brain cancer. So that means it's going to take place in the central nervous system. There's not a specific location within the brain that it's primarily found, but it will take place, have a tumor within the central nervous system. It is considered a grade 4 tumor, and so as a whole, glioblastoma is assigned a grade on the tumor depending on the type of cells that it presents within the tumor. So this means a grade 4 is one of the further down descriptors, so it means it has very abnormal cells. The name glio refers to the glial cells within the central nervous system, and so that means we don't know a lot about them and specifically all their functions, but we do know that they're support cells of the neurons. And so specifically, glioblastoma is an abnormality in the cells, the astrocytes, and so they're going to look very different than how they're normally supposed to look. A grade 4 tumor also indicates that it's very fast growing and highly malignant, meaning that it's going to very rapidly divide these abnormal cells, and then it has the possibility to spread to other parts throughout the brain and the body. It is commonly diagnosed within adults, not very frequently found within children, and it accounts for about 50% of all gliomas. Unfortunately, glioblastoma has a very low survival rate. There's only a 12 to 15-month median survival rate, and this can be a factor specifically if there is surgery available or the methylation status of the MGMT promoter region. So currently, the standard form of treatment has been about the same for about 20 years. We start out with surgery. Obviously, we're dealing with the brain, so you can't just remove half of the brain and expect the individual to have a normal bodily function following. So that's why we term it maximum safe resection. So the most amount of the tumor around the brain, or most amount of the tumor that we can remove from the brain without causing too much subsequent damage to the individual. And then radiation and chemotherapy paired together. For my honors project, I focused more on the chemotherapy side. However, there are advancements in radiation being studied currently. So the common chemotherapy drug is TMZ, which is a DNA alkylating agent. So what this means is it's going to add a methyl group to the DNA, causing a DNA mismatch, and then enough accumulation of DNA damage to trigger apoptosis. So you can kind of see that in the image down here below. TMZ is going to come into the genome, it is going to cause some DNA damage, and with enough DNA damage, the cell will undergo apoptosis, which is a normal programmed cell death. This is how a lot of chemotherapies work, as well as radiation. The goal is to cause a lot of DNA damage in these tumor cells, so that way they don't divide as well. So when there's enough DNA damage, cell death, the tumor won't grow as fast, which is a better survival for glioblastoma because there is this sensitivity to TMZ. So like I mentioned, this is our standard form of treatment. It's been about the same for the past 20 years. A slight clarification with methylation. I'm going to be talking a lot about different methyl groups. And so like I just mentioned with TMZ, it can cause DNA damage when you add a methyl group. But methylation is also important in the regulation of gene expression. And so it can be like a positive thing. And it is used naturally throughout the body to either enhance or repress the expression of the genome. So that moves us on to our MGMT protein. So MGMT stands for 6-methylguanine DNA methyltransferase. So it makes sense on why we just call it MGMT. And it plays an important role in suicide repair. So within our cells, our body has natural mechanisms in place to repair any damage to our DNA. We don't want to divide our cells if there's damage in our DNA. We want to maintain the integrity of our genome. And so there are proteins which play an important role in this. MGMT is one of these proteins. And so what it's going to do is it's going to have a single step direct transfer of a methyl group from DNA onto its own active site. We can kind of see that in the image below. And it's considered suicide repair because once there is a methyl group on the active site of the MGMT protein, it is no longer functional and will get degraded. And so if there is a methyl group added by outside causes, there's constantly things interacting with our DNA that can cause this damage. It's going to repair the damage to it. That then allows the cell to continue to divide without accumulating this damage and having to go through apoptosis. So we can see that this is going to indirectly interact with TMZ. As TMZ is adding these methyl groups to the DNA, trying to accumulate damage, our MGMT protein is going to be removing these methyl groups to maintain the integrity of the genome and allow the cell to continue to divide. And we can see that up there. At the very top, we have our DNA mismatch from some sort of methyl group, and then when the MGMT protein interacts with it, our DNA is repaired, and we have the little smiley face, so it can continue to divide. So the MGMT protein itself, its presence is regulated through gene expression. Specifically, the MGMT gene is found on chromosome 10, and the methylation of the promoter region, which is a short segment of DNA before the actual gene itself, allows it to inhibit being expressed in the cell. So with that, DNA methylation follows the central dogma of molecular genetics, or molecular biology. So we have DNA, which will undergo transcription into RNA, which then will undergo translation into a protein. And so this is really important. This is how all of our genes get transitioned into proteins in our body. And so if we inhibit the transcription portion of it through epigenetic transcriptional regulation, then we're not going to have our DNA converted into RNA. Subsequently, we're not going to have our protein formed. And so DNA methylation is just one of these epigenetic modifications that can occur within the cell to inhibit or enhance it. In the case of MGMT, it will be inhibiting it. And so this occurs through the addition of a methyl group to a cytosine residue, specifically at CpG islands, which are just high concentrations of cytosine and guanine base pairs. And they're commonly found in the promoter region which again is the little segment of DNA before the actual gene itself. All right, combining all of this together, this is why this matters for glioblastoma. And I'll kind of walk through this image because I know that it's a lot to look at. But at the top here, let's see, maybe it will work. Okay, at the top here we have our promoter region, which is before the actual gene itself for the MGMT protein. Remember, following the central dogma, we need the gene to be transcribed into the RNA for it then to be translated into the protein. So when we have an unmethylated promoter, there are no methyl groups present at the CPG islands within the promoter region. It allows for our DNA polymerase to come in, transcribe the gene, so then we subsequently get the MGMT RNA, followed then by translation into the MGMT protein. On the bottom here, we have a methylated promoter, so we see that these methyl groups here are present on the CPG islands of the promoter region. So that's going to block any transcription of the MGMT gene, resulting in no MGMT RNA and no MGMT protein. So that's kind of our two key differences between our methylated promoter and our unmethylated promoter. When it's unmethylated, we have an MGMT protein. When it's methylated, we don't have an MGMT protein. So now why does this matter? Well, because TMZ here is going to cause DNA mismatch by adding the methyl group to the DNA. So it's causing this DNA damage in both cases. However, when we have an MGMT protein present, we have our DNA repair. So that means that the tumor cells can continue to divide and grow and allow tumor growth and a poor survival for the individual diagnosed with glioblastoma because there is a resistance to the TMZ chemotherapy. However, on the bottom here, when we have a methylated promoter, there's going to be enough accumulation of damage because we are missing the MGMT protein to fix the damage. So that's going to cause our cells to undergo apoptosis, leading to tumor death and a better survival for the individual with glioblastoma because there's this sensitivity to TMZ as a chemotherapy drug. So through this, we can really see that the difference in methylation can help with our outcome of glioblastoma. Because if you have this methylated promoter, you're going to be more sensitive to TMZ, and the TMZ is going to be more successful in the treatment. So after kind of coming to understand all of this and the complexity of the nature of it, it led me to ask the question, is there an alternative option to TMZ? As I stated before, TMZ is our standard treatment option. It's been the same for about 20 years. So what do we have for individuals who are diagnosed with glioblastoma who have a unmethylated MGMT promoter region? Because they're not going to be as sensitive to the TMZ drug. So I went through a lot of different alternative treatments, and since I don't want to be standing up here forever talking to you about them, I'll just talk about a couple that I did go through. Specifically starting with combination chemotherapy. So the idea here is, what if we added another DNA alkylating agent? There's other drugs out there that are used for other types of cancers, and so what if we just added another one and we caused enough DNA damage that those cells really undergo apoptosis? Unfortunately, when you add a lot of chemotherapy drugs, your body can only withstand a certain toxicity level. And so by adding more chemotherapy drugs in these clinical trials, they found that the individuals were just experiencing too many cytotoxic effects, other organ systems were being affected, and altogether has not been a recommended form of treatment. So then they thought, what if we could target other pathways? What if there are other things within the cell that we could really interact with that aren't specifically related to the MGMT region? And so one of these was PARP inhibitors. PARP inhibitors have been used for a variety of other cancers, including ovarian cancer, with very high success rates. And so PARP inhibitors specifically inhibit the PARP1 and PARP2 proteins, which are important in base excision repair, which is another type of DNA repair. There's multiple different repair mechanisms within the cell that can help repair the genome. And so if we inhibit another one of them, maybe then we'll have enough accumulation of damage to then trigger apoptosis. And so this was the specific study that I looked at was a phase 2 clinical trial, there we go. And it really looked at trying to increase the progression-free survival as well as the overall survival rates specifically only looking at individuals with unmethylated MGMT glioblastoma. Unfortunately, at the end of the clinical trial, there was no statistically significant difference between the standard care treatment and the using of a PARP inhibitor, and so therefore it didn't continue on to a phase 3 clinical trial. Next, looking at VEGF inhibitors. VEGF is important in the angiogenesis, which is the formation of new blood cells, or new blood, blood vessels, there we go, that's the word, which is a hallmark of cancer. Often tumors are very rapidly growing and they need nutrients very quickly, and so they will form new blood vessels to bring in these nutrients. And these blood vessel formations are not very stable, they're often leaky blood vessels. And so one area that we can target, specifically cancer cells, is then to inhibit the formation of new blood vessels, so that way they're not getting those nutrients that they need. Unfortunately, this does come with a lot of side effects, including any damage to your body. It's not going to be able to heal as fast because we're inhibiting the formation of new blood vessels. And so there are a lot of problems and symptoms that individuals experience with VEGF inhibitors, specifically in the GI tract and wound healing. And so it wasn't recommended to continue the study. Integrin inhibitors are another thought of treatment because they are going to target the tumor microenvironment. They're important proteins in holding things together and allow for metastasis to occur. And so by targeting them, we're again targeting these tumor cells. Unfortunately, this study did not increase the overall survival rates or the progression-free survival. So all of these studies did not continue because they were not found to be better than the TMZ treatment itself. So that was very sad and kind of a disappointment for these individuals who have an unmethylated MGMT promoter region. So then we thought, are there other alternative treatments? Let's think a little bit more outside the box. And then we came up with tumor treating fields, which are kind of unique for glioblastoma because it is a little bit more of a complex treatment, but it is when you place nodes on the scalp that then will allow for an electromagnetic field to go around the area that prevent mitosis. So because mitosis is an important step in cellular division, inhibiting cellular division by inhibiting mitosis isn't going to allow for those cancer cells to continue to divide. And so this has been FDA approved and used in practice. However, it is not better than TMZ. And so it can be used with TMZ, but it will not be able to replace TMZ. It also can be hard for some individuals because they can experience some scalp irritation from it. And then additionally, some individuals decide not to do it because they have to wear these caps for long extended periods of time. They can be uncomfortable, they don't look very pretty, and so it is pretty much dependent upon the individual with glioblastoma on whether or not they use tumor treating fields as a treatment option. Then moving on to immunotherapy, which has been an emerging area, specifically within cancer. There is talk of clinical trials, very early stages, specifically for glioblastoma. But we do run into the problem there's not a lot of immune cells within the brain. And so using the immune system becomes a little bit more complicated because we're not going to get as much of a response as we would with targeting other types of cancer. Vaccine therapy was mentioned in one of the review articles that I read, which I thought was new because I hadn't heard anything too much of it. And it didn't give a whole lot of information, but because it's very early in development, but it'd be targeting specific proteins on the outside of the tumor cells themselves. So, unfortunately, none of these treatments are able to replace TMZ, and there isn't any other alternative option that works as well as TMZ. And so, for individuals who are diagnosed with an unmethylated MGMT promoter region, they're kind of stuck with the standard care of treatment. And about 60% of individuals diagnosed with glioblastoma are diagnosed with an unmethylated region. So about 60% of those who have glioblastoma aren't as successful in responding to the TMZ treatment that is being used. So in conclusion, glioblastoma is an aggressive brain cancer that takes place in the central nervous system. It has a standard treatment that's been used for the past 20 years, including surgery, the maximum safe resection, removing as much of the tumor as we can, and then radiation and chemotherapy with TMZ, which is an alkylating agent, as the primary source of chemotherapy used. Unmethylated MGMT glioblastoma shows a resistance to TMZ because the MGMT protein, which is able to be used because there is no methylation in the promoter region, is going to repair the damage that TMZ is causing. Clinical trials for alternative options have not been successful in finding an alternative treatment for individuals with an unmethylated MGMT promoter region. Therefore, research really needs to continue in this area, and it is continuing with a lot of clinical trials being studied to try and find alternative ways. I'd like to take a moment and thank Dr. Pekenschneider for all of her help, for really supporting me in this research. The Wayne State College Biology Department, there are so many classes that I had to take to gain an understanding of what was going on at a cellular level like this, as well as the Wayne State College Honors Program, for really giving me a space to do this research and a platform to share it. These are my references, and thank you. Yeah, if anyone has questions.
Juliana?
Yes.
How is the, and maybe you talked about this and I just missed it, how's